Hello, everyone, and welcome to today's Adult AML Chapter event brought to you by the HealthTree Foundation for AML. I wanted to take a moment to introduce myself to anyone who wasn't in attendance at our last AML event. My name is Mary Arnett, and I am the HealthTree for AML Community and Education Manager. Katie, who all of you know and love, is still with HealthTree and will still be around, but she's been promoted into a new role as HealthTree's Director of Education. We love her and we are so lucky to have her and all that she brings to this role. I have been running our MDS community and education programs for the last year and have been loving getting to know our AML community over the last few months. I am so grateful to have each of you here in our meeting today and for all of your support in building this AML community. I'd like to let you know that today's session will be recorded, and the recording, along with the slides and any resources we discussed today, will be sent via email to all registrants 48 hours after the event has concluded. I'll start real quick with the Zoom tutorial for anyone new to the platform. We would love for you to turn on and keep your cameras on if you feel comfortable. Doing so helps us to create a stronger sense of community. You can see on the slide how to turn on your camera. At the bottom of your screen, you should see the microphone and camera buttons, and you can click the video icon that says to start video in order to turn your camera on. With that being said, if you're not comfortable being recorded, you are not required to keep your camera on. Your microphone should be currently off and will be kept off by our team throughout the presentation. During the group discussion, you're welcome to unmute yourself once you're called on. If you have any questions or comments for us or for our speakers throughout their presentation, please click on that chat icon and type them in the box. If you're using a mobile device or a tablet, click the three-dot icon that says more and then chat in order to access the chat box. And lastly, if you would prefer to verbally ask a question or make a comment directly to our speakers during the discussion time at the end, we encourage you to do so. If you're using a laptop or a desktop computer, click reactions near the bottom of your screen and then click to raise your hand. If you're using a mobile device or a tablet, you can click the 3 horizontal dots that say more and then click the raise hand button. Now let's get started with today's event. First, I would like to thank our sponsors without whom this event would not be possible, and those sponsors are Servier and Estella's Pharma. Today, the topic of our event is cancer-related cognitive impairment strategies and support. I am really excited about this topic, and I hope all of you are as well. So here is our agenda for today. I'm going to introduce our
You just got muted. It like cut out for a minute when you were talking.
I was muted the whole time or just recently?
Recently. So when you started this slide, you got muted.
Oh, okay, thank you.
You're welcome.
So we're going to introduce our speaker, and then we're going to spend the next 30 minutes or so giving us a presentation. After the presentation, we're going to open it up for questions and comments about the event and we'll share any announcements. So first, I get to take a second to introduce our speaker. Dr. Alik Topolin is a 2-time cancer survivor. She was first diagnosed with AML in 1998 at the age of 4, and then relapsed in March of 2021 at age 27. She is now in remission and using her voice to passionately raise awareness about the unique needs of cancer patients. At age 7, she began to advocate for childhood cancers and raise awareness about bone marrow and cord blood donation. Her experience with childhood cancer inspired her to obtain a master's in public health and a PhD in health promotion and education, completing her degree in 2020. Her research focused on mental and behavioral health, examining prospective factors in resiliency. Little did she know that in March of 2021, she would relapse with AML, the first person to ever relapse after 22 years. Since her relapse, Alik has spoken at national and local conferences using social media and other forms of communication to give cancer patients a voice. She was selected as a 2022 recipient of the 40 Under 40 in Cancer Award. She is sharing her recent experience with the University of Cincinnati as a research scientist to the patient experience, AYAs, and survivorship. So I think you can see why we are so excited to have her speaking with us today. And with that, we're going to go ahead and turn it over to her, and she's going to go ahead and give us our presentation.
Awesome. Thank you so much for that introduction, and so happy to be here with all of you guys today. I see some familiar faces from some other things that I participated in with HealthTree, so that's always a great thing to be able to see some people again. But oops. Are we able to see my screen okay? Does it have the slides? Okay, good. All right. So I will just go ahead and get us started. So this is probably one of the most common things that we hear as a complaint from individuals affected by cancer. So we're going to be talking about cancer-related cognitive impairment and its strategies and support for what used to be known as chemo brain. So does this sound familiar to anybody? Going into a room and forgetting why you went in there, forgetting directions to a really familiar location, or misplacing something you had in your hand a few seconds ago. I know for me, a huge one is forgetting your passwords and your access codes, or not remembering a word when you're trying to. And if you have experienced any of these things, this session is for you. And one of the things I want you to think about the most is how much the difference between instances like this happening to you have changed from after your cancer diagnosis compared to before. So what is chemo brain? So chemo brain involves a lot of different areas. It's memory lapses, difficulty staying focused on a task, troubling remembering details such as names, dates, or phone numbers, difficulty multitasking. So say you're trying to have a conversation and follow a recipe at the same time. That can be kind of difficult. It can also cause people to be slower to process information, and it can also lead to difficulty with word retrieval. But as cancer survivors, how common is this? How common is it that, once we go through treatment, we start having these cognitive difficulties? And actually, up to 75% of patients experience cognitive difficulties during treatment, and up to 35% have symptoms that persist for months or years after. So I learned about this very early on when I was diagnosed when I was 4. Actually, when you're treated with childhood cancer, some of the drugs that you receive can actually crinkle the myelin on your brain that's developing while you're in treatment. So that actually happened to me during my first diagnosis when I was 4, leaving me with some different learning disabilities in the realm of executive functioning. The physicians told my parents that I would probably never be very successful academically, but my mom and dad ensured that they put me in all of the specialty tutoring programs, had me on an IEP, and basically wanted to figure out, is this actually the case? Or are we going to be able to overcome this with the right training? And we were, and I was actually able to be very successful academically, which is something I'm very thankful for my parents for actually pushing so hard throughout my entire life by wrapping me in this kind of support. But then when I relapsed and I was 27, I had just finished my PhD, and I was so used to my brain being very, very high functioning. I was coming out of that PhD program, and I swear I didn't think my brain had ever been as good as it was. And then I went into treatment, and I started having problems with word retrieval. I started having problems with memory in general, finishing sentences, simple sentences, not being able to remember what I was looking for, what I was doing. And, my now husband was very afraid, is her brain going to stay like this? Or is she going to go back to how she was before? And what we've learned is it's a little combination of both. So I might not be as sharp to the point as I was before cancer, but using a lot of the cognitive coping strategies that we're going to go over today, I've been able to go back to work full time, and I've been relatively successful in all of that. So, hopefully we'll be able to pass over some of those things to you guys today. So a thing that plays into cancer-related cognitive impairment, probably heavier than almost anything else, is this cancer-related fatigue. And I'm sure this is something that you all have a lot of experience with. Healthy fatigue in a typical person, that usually gets relieved by rest and sleep. You ran a marathon, you want to take a rest, you're up too late, you sleep in later the next day. Cancer-related fatigue is a persistent sense of physical, emotional, or cognitive tiredness or exhaustion, and it's usually related to cancer and its treatment. It's not typically proportional to any kind of recent activity that you've done, and it usually does interfere with your usual functioning. And because of this fatigue, it affects your cognition. It gives you difficulties while trying to concentrate and engage on a task. It provides challenges while taking in information, and trouble thinking clearly while you're trying to make decisions. So there's been so many people who've said, is chemo brain real? Is this cancer related cognitive impairment real? So this is a study that was done. And if you can see, twin A was treated with breast cancer and had chemotherapy. And you see all those lights and all the different places in the brain where it's lit up compared to where twin B is. So that's showing the different areas of cognitive impairment that are actually impacted in your brain after going through chemotherapy or cancer type treatment. But what makes this happen? This is something that we've really in the field been trying to figure out. We're still trying to figure out, but this is kind of the best model of what we've came up with so far. So CRCI, cancer-related cognitive impairment, that's what we've been using instead of chemo brain, and we'll get into that in a little bit. But what affects it? What makes this happen? Because we're seeing cancer-related cognitive impairment in individuals who've never been treated with chemo. We're seeing it in individuals who have only been treated with radiation. We're seeing it in individuals who've only been treated with hormonal therapy. We've even actually seen cancer-related cognitive impairment in patients before they even start cancer treatment. So is this a product of the cancer itself? Is this a product of the treatments? Where exactly is it coming from? And one of the things that we've come up with is that it's coming from these things called inflammatory cytokines. Now, cytokines are basically a cell that gets released in your body when you're really sick. A lot of times you get them when you have the flu or COVID or another kind of common cold. It's kind of what makes you have that groggy when you're sick, I can't really think kind of feeling, trying to get work done on a day when you're all stuffed up and not able to think clearly because you're not feeling great. That's usually due to your inflammatory cytokines, and they increase inflammation throughout your whole body. But it's also due to things such as cancer's treatment, hormonal changes, medical problems such as genetics, your pain, and medication side effects can all go into cognitive impairment. So can poor sleep, depression and anxiety, chronic stress and loneliness, poor nutrition, and lack of exercise. So that's why there's not necessarily a one-size-fits-all approach on how we're able to address cancer-related cognitive impairment in our patients. So related to an individual genetic background, this is kind of showing you a different breakdown from the last slide. So this is showing, individuals have immune cells and tumor cells, right? And your immune cells, they get impacted by this psychological distress. And tumor cells, those are what we want to focus on with our cancer treatment, right? So chemo, radiation, surgery. Now, immune cells and tumor cells, those both lead to the creation of cytokines. So the creation of cytokines, though, has an impact on your levels of pain, your psychobehavioral symptoms, and your overall recurrence and progression. So when we're talking about the cognitive behavioral symptoms that cytokines are actually impacting, we're seeing cognitive impairment, fatigue, and depression as some of the most common. So this is why we're changing the narrative. We're not trying to stay chemo brain anymore. We're trying to go to cancer-related cognitive impairment. And one size doesn't fit all. This is not one single symptom or one single set of symptoms that's the same across the board. And something I want to keep, hitting on the head over and over again is you do not need to be treated with chemotherapy to have cancer-related cognitive impairment or what was formerly known as chemo brain, because then we're missing huge pieces of patients who didn't receive chemotherapy but are still having the same level of cognitive impairment. So neuroplasticity is something that's incredible that the brain is able to do on its own. So the brain is able to change its own structure and function through consistent thought and activity. So your practice skills, the things you do over and over again, those are going to prevail. And your unused skills will be forgotten. It's basically a use it or lose it type perspective. And it can also lead to negative patterns such as chronic anxiety and depression. So if you're always having negative thoughts, it can lead to your brain processing a cycle of negative thoughts continuously. Same with chronic pain or phantom pain. So a really great quote that goes along with this is a single footstep won't make a path on the earth. So a single thought won't make a pathway in your mind. To make a deep physical path, we will walk again and again. And to make a deep mental path, we must think over and over the kind of thoughts we wish to dominate our lives. Neuroplasticity has a lot to do with things such as never forgetting how to ride a bike. That's where this all comes from. And so where is this coming from, though? Like, what are some of the things that we're seeing in this population? So we're seeing poor attention, so issues with short-term memory, poor executive functioning, so that's your working memory, poor information retention, so that's consolidation of your memories once they're all in your brain, and then other factors such as depression, anxiety, stress, fatigue, and medication side effects. So research is showing that depressed cancer patients are actually at greater risk for poor life expectancy, and it can impact your immune system. And so can the choices that are made as a result of your depression. Sometimes individuals who are depressed either sleep too much or sleep too little, don't always have the best nutrition, and sometimes don't get exercise. And then stress, chronic stress can impact our tumor growth and metastases. And mood, such as depression or anxiety and stress, all influence our cognitive functioning. So, what exactly is stress? So, stress is our emotional and physical strain that's caused by our response to pressure from the outside world. It's almost impossible to live without some level of stress. I'm sure most of you feel that same way. And sometimes stress can be adaptive in many ways and give us needed energy and motivation. I know me, I'm a procrastinator. The closer it's getting to a deadline for something that's really important that I need to do, and the more stressed I'm getting about it, the more I'm going to be able to do it and knock it out of the park faster. But if stress gets out of control, it can be harmful. It can harm your health and your relationships and your overall quality of life. So something that you can do to help with stress is mindfulness. So mindfulness is a philosophical concept of present-centered awareness. It's paying attention to the present moment intentionally without judgment, blame, or labeling. And it's separate from guided imagery or relaxation, but it may result in a relaxed state. But a relaxed state's not necessarily the goal. The goal of mindfulness is to have awareness of the present with acceptance. So acceptance is a willing to experience things as they are at the moment we become aware of them. It's not an endorsement saying you want it to be that way or a different way. And then meditation is a practice that's focusing the mind to train to pay attention to mindfulness and awareness. So when you're combining those together, you get mindfulness meditation. And that's the core theory for mindfulness-based stress reduction. Improved sleep, quality of life ratings, and immune parameters have all been improved through mindfulness meditation. And it's also been shown to have improved cognitive processing, such as working memory, and significant decreases in ratings of perceived stress, depression, and anxiety, while also helping to increase positive mood. So there are 4 foundations of mindfulness. So there's mindfulness of the body. So that's awareness of pain with expanding descriptors, awareness of breathing, and intentional awareness of bodily processes. Then there's mindfulness of feeling. So this is the intention to seek and explore each feeling as they arise in your brain and as they pass, and the desire to become precisely attuned to your feelings. The third foundation of mindfulness is notice the labels, judgments, or thinking traps as they arise to your consciousness. So this is mindfulness of the mind. What's happening? Notice the presence or the absence of these thoughts. And you may attempt to see during a meditation your thoughts as clouds. So some clouds may be wispy or barely there, and others may be dark, swirling, or seemingly impenetrable. Those can be some of your more negative thoughts. But through it all, the sky beyond remains unchanged and stays blue. So that can be a helpful way to go about your mindfulness practice. I know I always have a hard time blocking my brain when mindfulness comes, because it's not about not having thoughts. It's about acknowledging them for what they are. And then there's mindfulness for mental objects. So this is the changing patterns of your own experiential landscape. And so what does it look like to you on a personal level? Allow yourself to be open to new possibilities and observe things as they are rather than just what we think they are. So usually at this point, I would do a brief mindfulness practice, but you guys are going to have a copy of the slides, and I want to make sure we get through all of our information. So I'm going to skip our mindfulness practice, but if you want to take a screenshot or look at the slides when they get sent out to you, this is a really easy, simple 5-minute mindfulness practice that you can try in your own daily life. It goes really quick, and it's a great way to work yourself up to heavier mindfulness practices in the future. So then laughter and humor, they help to strengthen your immune system. They help with your energy and your pain levels by helping your body with more endorphins. They help to reduce your stress levels and overall improve your emotional and your psychological health. We've seen laughter and humor helps things with fear, anxiety, depression, and builds higher levels of resilience. And it's also a powerful social tool. So it helps with group bonding and makes you more attractive to others as well. So what else can we do? We've talked about mindfulness. We've talked about making sure that we're laughing and we're having happy times as well. But another thing is exercise. And I know this is one of the ones where everybody's always like, okay, I'm tired. I'm telling you that I've got this really bad cancer-related fatigue, and you're telling me to exercise. Why? And that's something that we hear from all of our patients. But it can help reduce those inflammatory cytokines. And it actually is shown that highly fit individuals have higher activation in areas of the brain associated with intention. And highly fit individuals also show less activity in the ACC, which is a region that's associated with confusion and apathy. So typically, after a diagnosis of breast cancer, we've seen that women decrease their activity by 2 hours per week at least. In 3 years after cancer treatment, patients with early stage breast cancer typically have aged 20 to 30 years in terms of their cardiac fitness, just in 3 years. And only about 20% of cancer survivors ever recall having a discussion about the benefits of exercise with their providers. But what we've seen is that 60 to 75 minutes of moderate intensity physical activity per day has actually been correlated with decreased mortality associated with total sitting time. So if you're in a job where you're sitting a lot, we know that there is higher likelihood of mortality the more that you're spending time sedentary. But it's seen that 60 to 75 minutes of moderate intensity physical activity can help with 8 hours of inactivity. And basically it shows that physical activity is similar to that of smoking in terms of mortality risk. So what can exercise do for you? And I know this is a little bit kind of, I don't know why it looks the way that it does with its words, but it's a great diagram that goes about. So cancer-related fatigue, health-related quality of life, your physical functioning, your anxiety, your depression, and your lymphedema. There's strong evidence that exercise will help with all of those things. And then there's also moderate evidence that exercise will also help with your bone health and your sleep health. So cancer survivors should be counseled regarding the benefits of exercise. At least 150 minutes of moderate aerobic exercise per week was correlated with a 41% decrease in all-cause mortality. So moderate activity is when you're walking and you're not necessarily able to hold an entire conversation. You're getting a little bit out of breath. Or 75 minutes of vigorous aerobic exercise per week. So that's where you're not able to talk, you're not able to sing a song when you're exercising. You're just heavy breathing, vigorous exercise. We also recommend strength training 2 days per week. I know a lot of people sometimes think that, the only form of exercise, like the best form of exercise is just focusing on cardio, but it's not. In the cancer population, focusing on strength training is actually really important as well. And don't get discouraged. I know this is something that I have continuously had issues with. I have the cancer-related fatigue. I'm exhausted. I'm still on maintenance chemotherapy. And so my weeks when I'm on chemo, I really don't want to exercise. But I started working with an occupational therapist, and she told me that sometimes the things that we don't necessarily consider as exercise in the everyday population count for exercise for us now as survivors, such as heavy duty cleaning of your house with mopping and sweeping, things where you're going to get out of breath, lots of movement, that can actually count towards your exercise goals. And then mood and thinking. So we talked about this a little bit, but mood refers to a variety of emotions. It can have depression, anxiety, and stress. Mood can influence cognitive functioning, and depression itself can actually mimic memory disorders, executive functioning disorders, and has a high correlation between subjective memory complaints and depression. Oftentimes, Alzheimer's patients don't usually report concerns with their memory. They're typically reporting concerns with other things related to their overall functioning that lead to an Alzheimer's diagnosis. But mood disturbances overall can cause fatigue, appetite changes, sleep problems, pain, less effective immune system, and a variety of cognitive difficulties. And so depression and anxiety are two of the most common mental health disturbances that we see. And health problems can result in or intensify feelings of depression and anxiety, or vice versa. Depression can have wide-ranging impacts on life expectancy, hormones, or the immune system, and choices we make about how we handle things in our life. Mood disorders are seen in up to 57% of cancer patients. So there's no normal. Not every patient develops clinical depression or anxiety reactions. But sadness, grief, and other things like that are common at one time or another, at least while you're going through treatment. And normal sadness is not clinical depression. Clinically depressed or anxious individuals should seek treatment. So here are some of the most common symptoms of depression. It's not the blues or a passing state of sadness. It's a mental health disorder that can interfere with one's daily life and your normal functioning, affect how you eat, sleep, feel about yourself, and the way that you think. And it's not a sign of personal weakness. So if you're looking at this list and you're seeing a lot of things and you're saying, oh, I've been experiencing that a lot lately, I would highly recommend bringing this up with your doctor to talk about different treatments that are available for you to make sure that you're able to have the best quality of life possible. And we see this again for anxiety. So anxiety, it is a very, very normal human emotion. It's very commonly experienced, but an anxiety disorder itself is a mental health condition. And that's when worry and fear are constant and it's interfering with your ability to function. We see a lot of anxiety, especially related to different things related to our cancer care and treatment. And that's normal. But if it's something that you are starting to feel is interfering with your everyday life, I would really recommend talking to your doctor if you experience these symptoms so that they can help you figure out the best treatment. So what can you do? Let's say that you are experiencing some of these symptoms, but it's not at the point where you necessarily are getting interference in your life. You can try doing things like monitoring your mood. It helps you to control your mood as opposed to your mood controlling you. You monitor your mood the same way you would with high blood pressure, calorie intake, or sugar. So a lot of it is having to do with a thought record. So when you're experiencing a thought, figure out on a piece of paper, right? Who, what, when, where, and what is it? What is this thing that's causing this feeling, this mood that you're having, and identify it. After that, say, what did you feel and what was your reaction to whatever this incident just was? After that, list your automatic negative thoughts in your mind. So negative automatic thoughts are things such as should have expectations, or all or nothing thinking, or black and white thinking. So only looking at the negative side of things can be an example of that. What are they, that the thoughts you're having in your mind? And then I want you to write down what supports those thoughts. So these negative automatic thoughts that you're having, the things that you're ruminating on, you're thinking of over and over again, what is the evidence that you have that actually supports it? And then after that, I want you to write out what is the evidence that does not support it. And after that, you can look at both of those and think about some balanced thoughts or some of the best outcomes that could happen from this. And then I want you to go back and re-rate your mood and see if you've thought about this all the way through. You know, this is something that we recommend a lot for patients when they're having really bad scanxiety, and you're really nervous about this next appointment coming up. Doing something like this with a thought journal can actually be really helpful in that situation. And then sleep. So sleep is incredibly important to rest our bodies, to repair our growth hormones and our immune function, our metabolism, plasticity, that neuroplasticity that we talked about before. And sleep disruptions contribute to depression, anxiety, and suicidality. We actually saw studies of rats where they usually live 2 to 3 years, but when we deprived them of sleep, they were only able to live for 3 weeks. Sleep deprived mice also had a 200% increase in speed and size of their tumor growth. And too little sleep was involved in the 2 Mile Island nuclear disaster, Chernobyl, the Exxon oil spill, and the Space Shuttle Challenger crash. So sleep is very important. But 50% of individuals with cancer report sleep issues. In our clinic that I run at that I help with at University of Cincinnati, 75% of our cancer patients actually have a diagnosis of sleep apnea, and 95% report some kind of sleep issue every night. But there's a lot of reasons for that. So it can be anxiety, depression, pain. Some treatments keep us up, such as steroids or being in the hospital with all of the beeping and waking up all the time. Obviously, we're going to have some sleep issues. But trying to focus on how we're able to get the best sleep possible. You know, one of the things that we're able to protect against is light at night. So light at night is actually associated with a higher breast, prostate, and pancreatic cancer risk. And we've seen that there's a 30 to 50% increase in risk of breast cancer in countries with the highest levels of light at night. So lower risk of breast cancer has actually been found in women who report longer sleep durations. And that's one of the things that we're hoping is if you keep the lights off when you're sleeping and try to get away from that blue light, that should be able to help you. So what happens with NBA players with sleep, right? So there was a study that was done, and the NBA players who had more than 8 hours of sleep had a 12% increase in minutes played, a 29% increase in points per minute, and a 9% increase in their free throw percentage. However, the patients who had less than 8 hours of sleep showed a 37% increase in turnovers and a 45% increase in fouls. And we've seen this with night shift workers as well, where there's higher risks of different cancers based on individuals working at night. Sleep disturbances lead to those cytokines and immune suppression that we were talking about before. And according to the World Health Organization, nighttime shift work is actually a probable carcinogen, which is really interesting. That's not something that we typically think of as a carcinogen. So what can you do? What can you do to help your sleep? So I would caution caffeine 5 to 7 hours before bed. Keep in mind that just because coffee is decaf does not mean that it has no caffeine in it. It still has some caffeine, so be cautious about that. Unplug from light and blue light before going to bed. Invest in blackout shades. Make sure your room is super nice and dark so it's the best place for you to be sleeping. And have a calming bedtime routine or ritual. Go to your bed only when you're sleeping. So don't watch TV, eat, read, or sleep in bed. I'm guilty for reading in bed. I know it's a really hard thing to change, but at least try to stay away from the TV or use a hard copy book instead of something like your phone. Get out of bed if you can't fall asleep within 20 minutes and return to bed only when you're sleepy. And don't nap during the day. It can also help to wake up at a fixed time each day and exercise. We've seen positive impacts from things such as acupuncture, yoga, music therapy, meditation, hypnosis, as well. So there's various levels of attention. There's orientation or arousal, selective attention, focused or sustained attention, alternating attention, and divided attention. So I'm going to talk about what each of these means and a little bit about how you can help with some of the things that you may have problems with. So attention arousal. One of the things that you can do is this is basically figuring out how alert you are and your own ability to respond to your environment. So to help with this, try to take frequent breaks. So 5-minute breaks every 20 to 30 minutes. Maybe just do a 2-minute mindfulness exercise. Sit upright when you're involved in tasks. Schedule your important tasks when you're most alert. So if that's the morning, early afternoon, I know for me, I start to hit a wall around like 3:30 and my brain stops functioning at its normal level. So I know I try to get my most important things done before that. Work on the least interesting tasks when your mental arousal is the highest, and change tasks frequently if you find yourself getting bored while you're working on one thing and not able to focus anymore. Switch to another one and see if that helps. It can also help to modify your environment. So have a well-lit room with a clock, calendar, maybe some interesting photos, and get adequate sleep at night. So then we have selective attention and focused attention. So selective attention is the ability to focus attention on specific stimuli while ignoring other stimuli. And then focused attention is the ability to maintain or sustain attention over time. So that's how we typically think of concentration. I'm going to skip this video for now in case, just because we're running a little bit closer on time. So for selective attention, things that you're able to do are wear an earplugs or a white noise machine, and rehearse or repeat the most important information that you need to remember, and try to think of cues to focus or refocus yourself. So something I've been doing is if I want to be working on a specific project for this certain amount of time, say I want to work on it from 10 a.m. to 12:30 and then start working on something else at 12:30, I actually set an alarm on my phone to go off at 12:30, or I'll set a timer for, say, work on this for an hour, and then my timer will go off and I know it's time to switch to another task. For your focused or sustained attention, these are going to be some of the similar things that we talked about before with attention arousal. So plan short activities, make sure you're taking frequent breaks, alternate your tasks and activities of the varying levels of interest, and ask for feedback. So ask others, how are you doing? Be open to assistance, be open to reminders, and develop appropriate expectations. So be sure to be compassionate with yourself. Understand that sometimes we need adaptations, and sometimes it can be a little bit slower to improve our accuracy overall. And then alternating attention. So that's going back and forth between two or more things. They're also known as multitasking. As I'm sure you know, that requires much more effort than sustaining attention on one thing individually. We also have a divided attention. So that's the ability to pay attention to more than one stimulus. Some believe it's rapid altering attention, but most people don't do this well. This actually contributes to the release of stress hormones and adrenaline. So having the stress hormones and adrenaline released in your body results in the loss of short-term memory, negatively impacts learning and information retrieval overall. So think about if you're trying to talk to someone on the phone while you're trying to send a text. I know me, I can't do both. I have to like send the text and I completely zone out with whatever the other person is saying to me at that time. So what are some strategies that you can use for divided attention? One of the most important is practice self-compassion. Try to avoid situations that require the diversion of attention, such as listening on the phone while doing something on your computer, or speaking to somebody while you're typing or texting. Use things such as lists or checklists, where each has to be complete before you're able to go to the next task. Or organizational strategies, list, written instructions, even verbal, if that works better for you. Allow adequate time for responding and self-pacing, and complete routine responsibilities in an orderly fashion. This isn't necessarily about moving the bar, it's more about modifying the lens through which we see the world. So it's not necessarily that we need to be at the same level that we were before, but learning how we're able to deal with some of these things to have the best overall impact moving forward is really helpful. So nutrition even impacts your cognitive, your overall cognitive functioning. We don't have data on the perfect diet for cancer-related cognitive impairment, so I can't say that if you eat this, everything's going to go away. And diet might only affect cognition in some survivors, but in general, nutrition can affect daytime sleepiness. It can also be found with fatigue, to be associated with fatigue in some breast cancer survivors. So dietary interventions have been found to improve some fatigue. So if it's improving your fatigue, we're hoping it's also going to improve your cognitive impairment. So one thing that we have seen repeatedly is that omega-3s are beneficial, especially for memory. It's got a lot of health advantages. It's anti-inflammatory and got antioxidant properties, and it's really good for your heart. Higher intake is also associated with a 25% reduction in breast cancer recurrence. But we don't manufacture omega-3 or omega-6 fatty acids ourselves in our bodies. So we have to obtain them from our diet. And one way you can do that is to replace bad fat with good fat, like avocado oil, avocados, olive oil, nuts, seeds, and olives. But watch out for omega-6s because those are actually not so great for you. It's unclear if fish oil supplements, so like omega-3 supplements, actually have the same benefits as eating fish itself. It's not as well absorbed, and you need a lot higher concentration. So that's something to just keep in mind if you're doing omega-3s through, a pill form. But we've seen that nutrition and cancer-related cognitive impairment, there was a survey, a study that was done on obese patients, and they were 3 times more impaired with information processing compared to the other breast cancer survivors in the study. We also saw that more physical activity was associated with better executive functioning and attention. We saw more sleep was associated with better performance and decreased odds of impairment with verbal functioning overall. So just some things to consider. If you eat meat, consider looking for grass-fed. If you eat seafood, try to consume at least 2 servings of fatty fish each week. Avoid processed vegetable oils and trans fats. Eat more fruit, veggies, nuts, seeds, and legumes. It's shown that eating patterns that have seafood are associated with a reduced risk of heart disease as well. So that's a good thing to keep in mind too. One of the things I say when I'm talking to my patients about nutrition is focus on color. The more colorful your plate is, the more nutrients that you're getting. Each nutrient is basically represented in fruits and vegetables as different colors. So the more colors you're getting, the more variety of nutrients you're getting. Other recommendations related to nutrition, try to only eat food without labels, not from a box, package, or can. I know that's completely unrealistic, but try to limit it as much as possible. Try to stick to labels that have fewer than 5 ingredients, cut out sugars or carbs such as white flour. Try to avoid high fructose corn syrup or anything that says hydrogenated. If you can't pronounce or read the ingredient, don't eat it. Try to avoid foods with preservatives, additives, colorings, dyes, and any kind of artificial sweeteners. So we've got a couple different patterns of memory, and I know I'm getting really close on time here, so I'm just going to finish up. But we've got verbal, which is like your personal info and events, nonverbal or visual, so like routes or where you parked your car. Motor memory, such as riding a bike or driving, your short-term memory, your cognitive or your working memory, and your long-term memory. So for short-term memory, these are some things that you can use to try and basically make sure that your brain is encoding the memories that you want. So it's very similar to the ones we talked about for attention problems. Train yourself to relax if stress or anxiety is one of the main issues, and minimize distractions. Try to focus on one task at a time. Don't do multitasking. Try to maintain eye contact with the individuals who are talking to you. Repeat information that needs to be learned. Ask questions to make sure that you're comprehending it right. Put information into your own words. That's something that's really helpful for me. If you put it into your own words, it's more likely that you're going to remember it. Make associations between items to be learned. Have something such as a daily planner, notebook, to-do list, and use things such as alarm clocks and timers. For actually memory retrieval, this can come to you or it can come from the people around you. So try to have other people provide you with cues if you're trying to remember something. You can leave messages for yourself, either phone messages or digital voice reminders. You can make notes and post-its. If you guys saw what my actual desk looks like under this screen, there are post-its and lists everywhere because this is how I organize my brain. And also use things like memory mnemonics. So verbal, this is kind of depending on if you're better as a verbal listener or if you're better as a visual listener. So if you're better as verbal, try to make your tasks verbal, describe pictures, say what needs to be done, read info out loud, tape record important informations or meetings, class lectures. And visual, if that's the way that you learn best, which is mine, make information visual as much as possible, write those lists, make pictures, diagrams, visualize stories you hear, and try to use flashcards and different repetition measures. So executive functioning is basically the how we do things compared to what we do. So a lot of times we'll see executive functioning. It really plays a role in almost everything that we do. So things that you can use to try and improve your executive functioning is to repeat and rehearse, rank tasks from basic to most complex, use strengths to compensate for your weaknesses, modify your environment, your social or your work role, make daily activities more routine, and allow time to complete tasks. For problem solving, something we recommend doing is kind of this breakdown of problem solving. So first, you want to say what the problem is. So say your transportation to a doctor's appointment had to cancel. And then the second step is list all the possible solutions to that problem. So you can cancel the appointment, you can hire a ride, or you can ask your neighbor or another friend. And then you go in and you list the pros and cons of each of those solutions, right? So you cancel the appointment and you reschedule. A pro is it gives you control, it reduces your current stressor. But a con is, it's prolonging your concerns and it impacts your doctor because you're canceling on their time. And then you do that for each of the solutions. And then after you look at your pro and con list, rate your solutions and implement the best option. So then coping, there is coping strategies. These are like really important to how you are able to handle things when they happen in your life. So use problem solving, use your breath and focus to control stress, practice active relaxation and mindfulness, and pace yourself to prevent a yo-yo effect. Pay attention to your own personal needs and feel without losing emotional control. But don't just sometimes use passive or partially effective coping. So watching a movie may help you with the distraction for now, but it's not going to actually help you with the problem at hand. So try to avoid things that are just distractors instead of actually addressing the problem that you're trying to solve. And pace and prioritize. These things are hard, and small changes make a big difference in the long haul. And habits take way longer to form than previously thought. It's anywhere from 9.5 weeks to several months for actually making a habit turn into an actual practice. So missing 1 or 2 days of repetition isn't going to interfere with your overall process, but making sure that you're continuously doing it over time is going to be the most important. and loneliness. So chronic loneliness can cause changes in your cardiovascular system, immune system, and nervous system. And it can have overall poor cognitive performance. You can have faster cognitive decline, poor executive functioning, more negativity, and depression. And lonely people typically have less enjoyment from their social interactions. We've seen shorter lifespans associated with a 26% higher mortality in the general population. And we also have seen it affect things such as depression, heart disease, infections, dementia, and cancer progression. This has typically been studied in the breast, ovarian, and colon cancer population, but we've seen it in other types as well. And overall, there was a new study that came out that social isolation has actually been found to be the equivalent of smoking 15 cigarettes a day on your health. So I know some of this was a little bit fast, but I want to make sure that we got through most of our topic without having before we opened it up for questions. So I would like to acknowledge this program was actually originally developed out of Cedars-Sinai by Dr. Arash Asher, and it's called Emerging from the Haze. So Emerging from the Haze is actually a 10-week long intervention, and this is basically the 10 weeks condensed into like an hour. So it's basically a little overview. And the 10 weeks are broken down by these individual like weekly priorities that we go over. And they are completely open to anybody. It's completely open to participate to anybody who wants to. I run it myself out of UC. It's 100% virtual. So if this is something that you find interesting and you want more about any of the things that we've covered, you can sign up here. Right now, we don't have a cohort running. Our next cohort will probably run in the new year. But if you get on the sign up list, your email will be on there and you can get information when we start offering our next cohort. And then I think that's it. Yeah. So does anybody, I would love to open it up to any questions or anything.
So like we just said, we're ready to ask any questions. If you have any questions, you can put them in the chat, or you can raise your hand and we can call on you if you'd like to verbally ask your question. And I just wanted to take a second to say thank you for this presentation. It was incredible. I learned so much. You covered so many topics that I think are so relevant to so many here. Do we have anyone who wants to ask questions? Looks like we have one in the chat. Sophie says, how do I start the conversation with my doctor about the depression symptoms that I'm having?
So I think if it's something that you haven't brought up before, even using this presentation as an excuse to say, you know, I just went to a presentation about HealthTree and they went over depressive symptoms and mentioned that if you're having a lot of these, which I feel I am, to talk to your doctor about it. You can use that as a great segue. You know, I learned about this recently. I would like to be able to address it with you. Doctors are supposed to be able to help you with all of your different concerns. So it's really important to mention that you're having those feelings to your provider so that they're able to give you the best treatment possible. So just be sure, you know, sometimes it's a hard thing to talk about. I always tell my patients, you know, if the heart of the topic, take a really big, deep breath and then blow out and then just almost word vomit it. Like just say it, you know, like that's one of the easiest ways that's how I do some of the harder conversations with my doctors, at least.
Megan asks, is the emerging from the Haze workshop available remote to join?
Yes, it is 100% remote. Actually, it all happens over Microsoft Teams. So that QR code on the screen that I shared, and it'll also be the same QR code on the slide that you guys are going to get a copy of. You can just use that. It'll bring you right to the straight up page, sign up page, or you can use the link that's next to the QR code.
We have another question. Michelle says, I'm thinking about going back to work, but I get anxiety when I think about going back. How do you overcome the anxiety about going back to work?
So there's a lot that goes into that. And the first thing I would say is make sure that you feel ready to go back to work. I mean, I finished my active treatment in like August and then started maintenance chemo, and then I didn't go back to work until March still. So make sure that you're doing it on the right time frame for yourself. I would also recommend, I mean, if you're going back to the same job or a different job, I'm not sure if you've ever heard of the organization Triage Cancer. I would be sure to look at some of their resources, because if you're going back to work, I would recommend making sure that you have some accommodations that can help you address anything that you may be dealing with now, from this fatigue to the cognitive impairment to, I mean, I know for me, a lot of my accommodations had to do with, since I'm on maintenance chemo and I'm 2 weeks on, 2 weeks off, a lot more of my accommodations have to do with like the specific 2 weeks on, or like if my ANC drops, I'm not allowed to go into the office, and things like that, to try and keep yourself safe and healthy and make sure you're balancing your work appropriately. Sometimes it's recommended to go back part-time, but I would definitely look at Triage Cancer. I'll write that in the chat. And they are all about them and cancer and careers. And they can actually help you with learning what accommodations are even available to you and helping you figure out how to start some of those conversations that can be a little bit more difficult.
Thank you for those suggestions and those resources. I'm sure those are going to be a great benefit to people needing to broach that conversation. And we had a comment from Julie, who says sometimes it's easier to have what you want to say written down when visiting your doctor. This is what she does. Depression is tough. Big hug. So yeah, this is a difficult thing that patients often deal with. And it's nice, like Julia said, to be able to have it written down. That way, when you go into your appointment, you're not having to try to think on your feet. We have another question from Steve that says, what are strategies to reach acceptance for the many things that are different after treatment that won't likely ever be the same?
Yeah, that is a good one. And I would say, out of some of the things that we talked about today, it would definitely be some of those mindfulness and meditation practices. Also, talking to a different, therapist or counselor in your area. I know everybody tries to say, oh, the new normal, the new normal. And I've always said, I hate the new normal, because this isn't normal. Like, what's happening to me isn't normal. So I don't want to be called normal, and I call it life now. And there's a lot of things that are different, and they probably won't be the same. And it's figuring out how we deal with that every day and how we approach it that makes us different. So I hope some of these things that we talked about with the mindfulness, even the exercise, things like that, but it's also about focusing on positive things. So finding things that bring you joy every day. That's actually like one of the slides I skipped over. But it says that one of the most important things you can do is find balance. So increase your pleasant activities. They say sometimes, like, if you make a list of like 25 activities that you find enjoyable, and just do a few each day. So it can be connecting with others, reading, looking at old photos, maybe listening to relaxation tape, whatever it is for you. Try to focus on doing a couple of those things each day that make you really happy. But I would also say, when you're trying to figure out how to accept some of these things, if it's really hard and you're having a difficult time on your own, I would definitely recommend talking to your provider about looking into therapy or other kinds of options, even a support group in your area where you may be able to talk about some of these things with others who've been impacted in the same way you are.
I just want to one more time say thank you so much for this presentation and for answering these questions. This is such an important topic, and I'm really glad that we were able to have you on today to kind of give us, one, your perspective as a patient yourself, and also your perspective as a researcher. I think that's an incredibly unique perspective that you have, and we're so grateful for your willingness to come on and talk to us today.
Of course, anytime. Thank you so much for having me. And anybody, if you have any questions or concerns, my email is in the slides, and same with the way to sign up for Emerging from the Haze. If that's what you're interested in, feel free to reach out to me at any time. I'm always happy to help.
So really quick, we are out of time. So I just want to again thank our sponsors for this event who make things like this possible, and that is Servier and Estella's Pharma. And then finally, I just want to say thank you to everyone attending here today for helping us to build a strong HealthTree community for AML. I appreciate all of you, and I hope that everyone has a great rest of your day. I added my email here to this screen, so please don't hesitate to reach out if you have any questions, if you have topic ideas for a future event you'd like us to cover, or if you want to meet with me. I love hearing from you, and I'm loving getting to meet all of you. I hope everyone enjoys the remainder of their week and the upcoming holiday season. And I look forward to seeing all of you at our next AML event.